I'm going to talk about the best Medicare supplement plan for 2019. And there are a lot of choices, so we want to make sure we get this right. So stay tuned. Okay, so let's talk about the best Medicare supplement plan for 2019. And the good news right off the bat is there have not been a lot of changes. So it's pretty similar to what it's been for the last few years, but I'm going to go over the different options, show you what I think is a better idea and certainly what is not a better idea. And you can see right here on this chart, the one that's highlighted is not a good idea. So I'm going to tell you exactly why that is and what I would do if I were choosing a Medicare supplement plan for 2019. Now, I've also now created a podcast because I know a lot of folks spend a lot of time in their cars and listen to stuff on the radio, and videos aren't so easy. So if you want to find this on podcast, you can. You just go to MedicareOnPodcast.com, brings you right to my podcast channel, and you'll get the same information that you have there. So I'm going to try and fit everything in that you need to know for Medicare for 2019. So we're starting here with the Medicare Supplement Plan. First question, why do I need a Medicare Supplement Plan? Well, if you're on Original Medicare, which is Medicare A and Medicare B, it covers most of your medical care, but certainly not all of your medical care. So Part A is the hospital part, and it has a big deductible that's not covered under Part A. And then Part B is the outpatient and doctor stuff, and it has a small deductible, but it also only pays 80/20. So in other words, you're responsible for 20%. Now typically 80/20 insurance is pretty good. The problem with Part B is that 20% has no stop. So if you have a disastrous year, your 20% can get extremely high. So the fact that it does not stop is really one of the biggest reasons that you want to have a Medicare supplement plan. So I'm going to show you exactly what they're about and what your choices are. So when we're talking about Medicare supplements, if you see my other videos, you know this is our chart of Medicare supplements, and they've done just like they always do. They've made it super complicated and super confusing and makes it hard, you know, why you would be expected to be able to understand this and figure out what's the best choice. It just doesn't make any sense. So we have here 10 choices. And if you look through, it goes from A to N, but there's letters missing in the middle. And there's some letters that used to be here that aren't here anymore. So it hasn't gotten any easier as it goes along. But we're going to break it down. The good news is there's way fewer choices than this. However, even though we show 10 here, there's really 11 choices. So if you see this little asterisk here, that's for Plan FHD. And Plan FHD absolutely makes sense in certain areas, particularly in Florida or New York or Connecticut. You absolutely want to look at FHD. The rest of the country, not so much, and I'll show you when we get into it why and where, so you understand it. And that's our goal here, is to make sure that we know what we're talking about, because I can tell you, with insurance agents like myself, there's generally at least one in every family. So you may have to have a brother-in-law with an insurance license that wants to sell you your Medicare supplement plan. And what I want to do is make sure that you make sure that he knows what he's talking about, or that she knows what she's talking about. So if you are in that situation where it's family and you have to use them, absolutely. So we want to make sure we know what we're talking about. So we're going to get there pretty quickly and pretty easy. And again, it's not that complicated. We're going to make it way fewer choices than the 10 or 11 that are here. So when we get kind of down to the meat of it, there's really 3 plans to concentrate on. There's Plan F, there's Plan G, and there's Plan N. And again, FHD in a certain part or certain parts of the country where premiums are much higher than other parts, FHD makes a lot of sense. So I'll show you how that all works. So when you look historically with Medicare supplement plans, if you talk to your parents or even with your grandparents before that, the majority of people in the past have been on Plan F. And why would the majority of people have been on Plan F? And it's pretty simple. It covers 100% of everything. There's no out-of-pocket cost with Plan F. So that's great, right? And most people think that way. The problem is it's not great. And in an insurance world, you don't want 100% coverage or your premium's going to be much too high. I don't know anybody that has 100% coverage on their car with no deductible or on their house with no deductible. You absolutely want to manage your premium as well as your benefits. So Plan F generally is sold by insurance agents because, number one, they make more money on it because it costs so much that they get a bigger paycheck when they sell Plan F. But from your standpoint, you would certainly overpay if you're looking into Plan F. Now, another reason Plan F is not a great idea right now, it is changing in 2020. And what it's going to happen is they finally decided they don't want any more 100% paying plans, because in the insurance world, it's not a great idea. So they're going to stop new enrollment into Plan F in 2020. So it could lead to higher rate increases in the future. There's no real data to predict that, but it makes logical sense that if you don't have new blood coming in and you have an insurance pool that just gets older and older, it's likely going to not be a good outcome on rate increases down the road. So that being said, Plan G. When you look at Plan G is exactly the same as Plan F. There's only one difference. Plan G does not cover the Medicare Part B deductible. And that in 2019 is $185. So your deductible would be $185 for the entire year if you're on Plan G. And then once you've paid the $185, boom, it turns into Plan F. But it's going to have lower premium. It's almost always $200 to $300 a year less than Plan F to take the $185 deductible. So obviously that makes a lot of sense to do. It wouldn't make sense to do it the other way. So Plan G is a terrific option if, and again, in different parts of the country, it depends on the premium on how much it is versus, for instance, N. So your other choice here is Plan N. N kind of wiggles its way in here as a pretty good option, and actually can be a really good option. Just depends on the cost and how you understand it. And when you look down the benefits for N, everything is yes, 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 just like G and N. There is a no by the Part B deductible, just like G, so it does not cover the $185 annual deductible. No big deal. It also has an 80%, a no next to Part B excess charges. So that's different than G and F. So Plan N does not cover excess charges. And it's a little confusing. It makes it a little gray, but it's not as bad as it sounds. What excess charges are is when you go to a doctor that accepts Medicare, they either accept Medicare assignment or they just take Medicare. And it can be confusing to some, for sure. It can be confusing at the doctor's office too. If a doctor takes Medicare assignment, then they agree to accept what Medicare is going to pay them as full payment. If they only take Medicare and don't take assignment, they'll accept what Medicare pays them, but it also gives them the ability to bill you 15% above what Medicare pays them, which, again, sounds kind of bad, but it's really not so bad. So in other words, if you had a $100 office visit, which it's not likely usually going to be that high, you may have another $15 charge from the doctor. But pretty rare to find doctors that do not take Medicare assignment. So pretty rare. And it's in the 90 percentile that doctors that accept Medicare take Medicare assignment. So it's just a good idea to understand it so you can ask that question ahead of time. Do you take Medicare assignment? And again, just keeps everything nice and clean. And the other thing here is we have on Plan N, next to Part B coinsurance, there's asterisks. So why would they put asterisks on our charts? Just like they did with the FHD. They're kind of hiding something here. So when we see, and there's 3 of them, so that must mean it's important. So when we see those, we have to go look and find out what they are. So there's some small print at the bottom that relates to Plan N. So let's take a look at the small print. So Plan N pays 100% of the Part B coinsurance, so it covers the 20% that Medicare Part B does not, except for a copayment of up to $20 for some office visits and up to $50 for emergency room visits that don't result in inpatient admission. So what that means is with Plan N, when you go to the doctor, you're likely going to have a $20 copay. It says up to $20, but let's take for granted it's going to be a $20 copay, although I hear all the time it can be $8 or $10. So you can have a copay when you go to the doctor. If you go to the emergency room, it's going to be a $50 copay. Again, not a big deal if there's enough savings and premium to make it a good choice versus getting G, where you don't have any of these copayments or excess charges. So another thing with excess charges, there's 8 states that do not allow excess charges. So these 8 states here do not allow excess charges. So if you live in one of these 8 states, it makes N a more attractive choice, because then you don't have to worry about whether or not a doctor takes Medicare assignment or does not. So let's understand about Plan F. So what's to understand about Plan F? Covers 100% of everything. Again, in the insurance world, that is not a good thing. You will overpay for your insurance coverage to cover 100% of everything. So it does have a high premium, and almost always more than $200 more than G, and the only difference on G is that $185 deductible. And then again, it's going to change in 2020, which leaves us in a little bit of unknown territory on whether it's going to be good in 2022, 2023, so forth and so on. So what I would say on Plan F is when to choose Plan F. And if you see my videos, I try to keep everything pretty clean and simple and black and white, so you don't have, I don't use a lot of graphics. But here I'm going to use a graphic on when to choose Plan F. And in my opinion, I would only choose it when pigs are flying. I would almost never, ever choose Plan F. Now, there are some scenarios where it's different. If you're guaranteed issue and you were on a plan that went out of business or whatever, and you're coming in, you might have to choose Plan F. But for regular, turning 65 or retiring, do not choose Plan F. Very bad idea. Your brother-in-law is going to tell you different. Your neighbor is going to tell you different. They're going to tell you how wonderful their Plan F is, and you just need to understand in the back of your mind how much they're spending, how much they're overspending, and believe me, you'll get an opinion from anybody. So what to understand about Plan G? Plan G is exactly the same as Plan F, with the exception of the Part B deductible. So Plan G is Plan F. The only difference is it does not cover the $185 annual deductible. I have no idea what kind of health insurance you're on right now, but I would bet dollars to donuts, as they would say, you have a higher than $185 deductible. You probably have a $2,000 or $3,000 deductible. So going to a $185 deductible and at the same time saving $200 or $300 in premium for the year, obviously easy to do. So when to choose Plan G? When you want an affordable premium. You need to bring your premium down. We don't want to be silly with that money. We obviously are retiring and we want to spend it on many other things. We want full coverage, with the exception of a very small deductible for the year. And again, that deductible runs January to January. So if you go and you meet your deductible in January of $185, you have 100% coverage the rest of the year. Pretty simple, pretty easy to understand, and we want stable rates in the future. Now, this doesn't guarantee stable rates, but it puts us in a much better position to have stable rates in the future. So that's what we want to try and do, is get there as best we can. What to understand about Plan N, and you can see here we got a little more information on the screen, so it's a little more to deal with, but if our premium is low enough, then it makes a lot of sense. So Plan N is exactly the same as Plan F and Plan G, so it's exactly the same as Plan F, except doesn't cover that Part B deductible, $185. If you go to the doctor, you're going to have likely a $20 copayment or less. It can be less than the $20. If you go to the ER, it's going to be $50 copay. That's not a big deal, and does not cover excess charges, with the exception of those 8 states that do not allow it. So we just need to understand that. And you know, excess charges, typically, I saw a study somewhere where an insurance carrier said over the last couple of years, the highest excess charge they had was like $20. So it's not typically a big deal, but it just needs to justify itself in the premium. So when to choose Plan N? So when we want to choose Plan N, we want to lower our premium some more. And again, if I were buying, I would buy Plan N if it's $25 or more less than Plan G. So pretty easy to kind of navigate that. If it's $10 less than Plan G, I'm buying G. If it's $15 less than G, I'm buying G. If Plan N is $25 less than G, then I'm buying N. Absolutely. If I can save $300 a year in premium to have those copays and then understand excess charges, makes a lot of sense. Again, we want full coverage, with the exception of small caveats of little deductible and little copays, no big deal. And again, we want stable rates in the future. So that, the more consumer costs that you have, kind of the better predictability it is for an insurance carrier, so that rates kind of stay, they know what their costs are going to be. So it makes a lot of sense to keep our rates stable in the future. Now let's back it up a little bit to what to understand about Plan FHD. And again, this makes a lot of sense in certain areas. Some in Florida, some a lot, almost always in New York and Connecticut, where premiums are high. And the reason premiums are high is because those states have mandated extra benefits for you, which is kind of good because it gives you more rights, but it also makes your costs go up a lot. So for instance, in New York, you can go open enrollment anytime. You can jump from a plan to another plan without medical underwriting anytime, which in other states you cannot do that. You have to go through medical underwriting. But in New York, what it does, it almost doubles the premium of the plan. So it gives you the ability to do what you want to do, but it raises your costs significantly. So what to understand? Plan FHD is, again, exactly the same as regular F, except it has a big deductible. So HD stands for high deductible. And these days, $2,300 might not really seem like that high a deductible. You might be coming off a higher deductible coming into Medicare. So Plan FHD has a $2,300 deductible. So in other words, January to January, you're responsible. So Medicare is going to pay their 80/20. They're going to pay like they regularly do on A and B. And then on your side, the 20% or the hospital deductible, you're going to be responsible for until you reach $2,300 out of pocket. If you reach $2,300 out of pocket, it's going to pay 100% the rest of the year. So what this does, and we talked about that 20% not having a stop, now it has a stop. In your worst year, if you get hit by a bus, it's going to cost you $2,300, and then it's going to be 100% paid after that. So that's the worst that can happen under FHD. So absolutely gives you great stop on your out-of-pocket expense, and it has a premium that is just super low. So when do we want to choose Plan FHD? And when I would choose it, where I draw the line, is if my Plan G premium, wherever we are in the country, if we get a quote and our best Plan G is more than $180 a month, I'm probably choosing FHD, because that FHD is going to be $60 or $70 a month, and we're going to save, sometimes you save more than $2,300 a year in premium to take the $2,300 deductible. It's a super easy choice in that case. I have a video specific on FHD. If you go to www.planfhd.com, brings you right to my video. I walk you right through FHD, but really only in certain states. If you are in Texas or Georgia or North Carolina, Ohio, Illinois, anywhere in the middle of the country, don't even waste your time looking at FHD, because your Plan G is going to be very affordable, or your N is going to be a little more affordable. So only in super high cost states like New York, Connecticut, sometimes California, Florida, and Florida's getting better now. So it's not really going to be that great of a choice in Florida soon, because the rates are coming down, which is a nice thing. So back to our plans, our choices. Do not choose Plan F. Please do not choose Plan F. Don't let your brother-in-law talk you into it. Don't let your cousin talk you into it, or your local agent talk you into it. It is a very bad idea. It just really is. So Plan G, Plan N, or possibly FHD. Those are your real choices. Makes things easy to understand. And this is obviously what I do. Is I'm an insurance broker, so I don't work for an insurance company. I work for you. And whatever we choose, number one, we got to figure out which plan. And then once we figure out which plan, we got to figure out which insurance company to go with. And that's what I do. And whichever insurance company we choose, they pay me some to be your service agent. So I do not work for the insurance carrier. I work for you. There's no cost for you to use me. I certainly would appreciate it If you do use me, that's how I make my living. If you visit my website, I've put together a tremendous amount of information for now and in the future. So make sure you understand how to get back here, because there's stuff here that you're going to all of a sudden need, and you're going to want to find it. So if you visit MedicareOnVideo.com, first thing you can do is get a immediate quote on your Medicare supplement coverage. So put in your basic information. We'll show you the lowest price on G, lowest price on N. If FHD is one that makes sense, we'll give you that as well. You can also download a discount prescription drug card right here on my homepage. Just click on that. It's free. There's no strings attached, and it will likely save you some money on your prescription drugs. And I have a resource center where I have, again, a tremendous amount of information. If you visit the resource center, you'll see what I have in there. And coming back to where you can get your quote, so if you just go to the middle of the page, that's where you can get your quote. If you go up to the top, you can get your discount prescription drug card, and then you come right over to the resource center and it'll drop down. You can find my videos there. You can also go into guides and forms, and I have a lot of information here. You can find right off the bat, if you are retiring and you're past age 65, when you sign up for Medicare, you're going to need to show proof of prior coverage. So most people don't know that when they're coming off, and you need a form that is filled out by your employer. So to get that form, you can download it right here. It's the employer coverage form. Download it, email it to your HR department, tell them you're going into Medicare, you need to fill out this form, get it back to me. And again, we need to do all this early. It's so much easier to do it well ahead of time so that you don't have any time crunches. Most employers know exactly what that is, but some of them are going to give trouble. It just depends on who you're dealing with in your HR department. While you're in guides and forms, I have a book, an ebook, Medicare Made Clear, where I cover just about every topic on Medicare. Great to have on your computer or iPad for now or in the future. So download a copy of my book, and you'll likely find it very helpful in the future. If you want to get back to my videos, pretty easy. Just go to www.keithsvideos.com. Brings you right to my YouTube channel. I have about 100 videos on everything Medicare. So if you want to find something specific, just click on the magnifying glass at the top, put in whatever topic you're looking for, Part B, Part A, supplements, dental, drug plans, whatever it may be. It'll bring up the videos that correlate with that topic. So it makes it very easy to find just what you're looking for. So I hope you'll visit my site, and I hope you find everything helpful, and I would certainly be glad to help you make sure that we get it right from the start, because you don't want to mess this one up, because it's very difficult once you're in Medicare to do things differently. So we want to make sure we get it right the first time. So I hope you found all this helpful, and keep looking for updated videos. I put videos out quite frequently, and I'd be happy to help with any of it. So I hope you have a fantastic day.